It's my honor and privilege to introduce to you your first speaker. So with all of that kind of housekeeping aside, Cynthia Fisher is the founder and chairman of Patient Rights Advocate. It's a nonprofit organization seeking healthcare price transparency, really giving power to American consumers to actually know their prices and actual prices, not just estimated prices, and focusing on competition and lowering costs of care and coverage through a functional marketplace and choice. She led the advocacy efforts that led and resulted in the federal price transparency rules. So I don't know if many of you know, but we have these federal price transparency rules for hospitals and for the insurers. One went into effect in 21 and the other one in 22. And Cynthia was the champion on that, really working with, so she's got a story to tell. And that's been many years now, and she's still at it. And it's so inspiring to me, gives me the confidence that we can really make a difference in this space. So please join me in welcoming Cynthia Fisher.
Insurers are robbing all of us.
100 million Americans drowning in medical debt.
When hospitals and insurers don't show us their prices, they charge us whatever they want.
Their greed is destroying the American dream.
We look to our elected officials in Congress
to put a stop to the overcharging.
Empower us with real prices and hold hospitals and insurance companies accountable.
We demand actual prices
and true transparency in healthcare.
Power to the patients.
Thank you, Gloria. Thank you all for the opportunity of being here today. What a difference you all are making. And Gloria, I'd love to give a shout out to you for that great Wall Street Journal article with you and Al Hubbard and Chris Zazek from Houston. Really amazing, groundbreaking work. But so many of you here in the room are really the revolutionaries behind substantially changing healthcare with access to prices. And it's so simple, and yet healthcare seems so complex. But when we know the prices before we get care, it's truly transformative. Prices protect patients. First and foremost, they protect all of us from overcharges in medical billing. So when we can see prices up front, when we get our bills and our payments, we can make sure they're true, they're accountable, and they have integrity. And the consumers, as you well know, because you are the Employers Forum here in Indiana, which is doing absolutely revolutionary, groundbreaking work to allow for lowering the cost of healthcare, getting access to the best quality of care at the best possible prices. And Gloria knows, as a leader of this important organization, that in order to do so, it's so common sense that the first thing we all need as employers and as unions and as patients is to have readily available free access to all prices up front before we get our care, so that not only can we be protected from overcharges in the medical billing and have remedy and recourse, but to start to create a functional and competitive market where who benefits from competition? The consumer. So when we can all get prices up front and we can see these prices readily, then we can start to shop. A novel concept in healthcare, however, it's how we function in every other sector of our economy. And I do want to share with you, we are 3.5 years in to now all hospitals having to show all prices in healthcare, and for insurance companies, about 3 years in, for all insurance carriers and third parties that administer employer and union plans, to show all of the actual prices in healthcare. And change is happening. I can tell you from a patient level, what's so exciting to me is getting over the hardship of extreme overcharges that patients have been burdened with, that have been absolutely crushing to their families, not only in their budgets, but their savings, and even whether they even continue to go seek the care they need because of fear of financial ruin when they haven't had prices in the past. So let me give you an example of a win for Cindy Reddy from Colorado, a school teacher who was 62 years old, retired because she had Parkinson's. She needed a hysterectomy. She came forward to the state of Colorado when they were putting forth a very aggressive bill to have all actual prices in healthcare, because she went and she asked, what is the price? What will my out-of-pocket be? I have coverage. And she got in writing, and was from both her insurer and from the hospital, it was a $5,000 estimate for the total charge for the hysterectomy, with a $500 out-of-pocket. She went forward with the procedure, only to be surprised months later with $74,000 bill, and the insurance denied her care. Months later, the hospital put a lien on her house. She tried to first negotiate with what she had in cash savings with the doctor, and he agreed to take his price down from $9,000 as an out-of-network provider to $5,000. She paid the doctor. The hospital put the lien for the balance onto her home that was fully paid by her and her husband. She came to us with financial ruin of fear of losing her home. When we went to the hospital pricing file, we saw indeed her hospital did accept the insurance, and the insurance did accept, and her plan was there. And we found that the total price of all of the itemized billing would be around $8,000, and her out-of-pocket would have been around $800, not a total of $74,000, including all inclusive of the physician fee. It took about 4.5 months for us to help fight that with her, but the lien was removed from her home. She proved it by having access to the actual prices. And what did she learn from that? Estimates don't work. Colorado also saw a young man with a $16,500 charge with an EpiPen that was handed to him after a visit to the emergency room. That was negotiated down to $4,900 for his $6,000 high deductible plan, his first visit of the year. He thought $4,900 for one EpiPen was outrageous. He came to us. We helped him look at the hospital pricing file, and what do we find? The charge master price total was $600, and the total price under his plan was $200 for an EpiPen, not $4,900. He wrote a letter to both CEOs of the hospital and the insurance company, and they said, oh, there must have been a glitch in their system. How many of you as employers know how many your employees suffer from glitches in the system? That's what price transparency has done. It has empowered these patients individually to have remedy and recourse. Moreover, what price transparency also does is it's starting to give employers and unions a tremendous way to not have to, by the hard way, reverse engineer prices from claims data and payment data. And the employers that started managing, as Gloria well knows, it's managing their health plans and your health plans by the numbers, just like you manage supply chain or you manage any other purchase. Those who have really gone out on the limb to lower their cost of care have reversed engineered the pricing by getting access to all of their billing and claims data and figured out what prices were, and then look for fair market prices. But the hospital price and insurance price transparency rule is starting to do a great reveal of comparative prices up front, so that employers can know whether or not what they're paying in their bills and claims are actually accurate to what their plan negotiated with that hospital on their behalf, and also to see what the competition is doing. And are they getting a good deal? Are all of you getting a good deal? What else have we learned from price transparency is that employers like Harris Rosen down in Florida has been able to reverse engineer these prices and also look at pricing from the hospital pricing files and choose to direct contract with hospitals when he wasn't able to get, for his 6,000 employees, 14,000 covered lives, wasn't able to get the appropriate market price for musculoskeletal, childbirth, and was able to create a plan that rewarded his employees. How? By cutting over time the entire premium amount and spend for health coverage by half. By half. And that is half of the national standard for employers across the country. What happened when a school district nearby in Orlando was facing a $12 million deficit in their health plan, being constrained for hiring new teachers or their education programs, is they went to Harris Rosen's hotels and said, "Will you show us the way?" And I can share with you, this is how transparency is working, is that in 3 years, they were able to shift their third party and their administration, learn from what Rosen Hotels had done, and save a total of $41 million that was then put back into the wallets and wages of everyone in their school system and back into their school district budget. This is huge. This is happening across the country where unions and employers are waking up to be able to leverage the knowledge of knowing prices, to be able to lower their cost of care and redesign their plans, to be able to steer their employees to better quality of care and outcomes at a far lower price. And let me tell you about what we're finding from the hospital transparency rules to date. Is across the country, we do a look at 2,000 hospitals every 6 months since the price transparency rules came into play. And what we found is across the country, we are at about 34.5% of the hospitals fully complying by posting all of their prices in a machine-readable file online so that any consumer can access it, any technology developer can access it, these files to be able to compare prices. Don't get me wrong, the rest of the hospitals in the country do have pricing files. Most of the hospitals do have a pricing file. In fact, you can go on our website, patientrightsadvocate.org, and every 2 months we sweep in all of the actual website links to all hospitals, the 6,000 hospitals in the country, into one place. So if any of you need one place to just go to find the actual pricing files, their very own files are put onto one place and open source for all of you. We also convert those files to an Excel type CSV file so that you can humanly read the comparisons by code. That's how we were able to help Cindy Reddy and the young man who had the overcharged EpiPen, by having access to looking at it as any of us would simply read a spreadsheet. What are we finding in the states where the states are really frustrated that the hospitals haven't come into full compliance and we have prices system-wide and freely available to all of us in the rearview mirror? So a lot of state legislatures, and thank you here, Senator Shadley, right? Did I get it right? Representative Shadley, for all of the leadership you have had in the state legislation. But what we're finding is that Health and Human Services, the federal government, has really been slow to truly enforce this law. And so we have seen only 14 hospitals been fined. And even though we have bipartisan support from 3 presidents, remember, this whole law was in the Affordable Care Act in the Obama and Biden time. And it was the Trump administration that put the law that was sitting on the shelf collecting dust, put it into rule of law and made it actionable. And then it was Biden who, when he came in, kept it in play and even increased the fines to $2 million per hospital that wasn't fully complying. And unfortunately, only 2 hospitals have been fined over $1 million. So, you know, it's really been slow to, you know, if any of us park our car in the wrong space, we get the ticket, right? They don't give us grace period of 3 months and then go back to, do you really want to park your car there? I have to say, you know, it really makes sense to just fine the hospitals up front, let them deal with the fines and come into compliance. But perhaps maybe, you know, we can look for that, forward to that in the future. But the reality is in the states where, like Indiana and like Colorado and Texas and Virginia and other states in the country Oklahoma, that are coming forward and saying, look, we're going to regulate it, and we're going to fine in the states for lack of access to prices, and we're going to protect consumers. So where we have the strongest aggressive actions in the states, we're seeing much better compliance. So for instance, in Colorado, where they have the strongest state law in the country for price transparency and consumer protection, we're seeing over 65% of the hospitals fully showing all of their actual prices. And I have good news about Indiana, because we're seeing over 55% of the hospitals fully complying with showing all of their prices. So keep up the great work. It matters. And what we're learning from the tech developers is as soon as they get 2/3 of the prices in those states, they can start to develop the tools to allow people to shop. And so we know, for instance, in Colorado, tech developers are now starting to put together shopping tools. Think about that. This is so exciting. So I applaud all of you in Indiana for all the hard work you're doing to work on this issue. And think about where we can go once these tech developers get a critical mass of prices around the country. Think of the future. Why can't we just Google search needing an MRI? And where can you get an MRI? And who's available, like ZocDoc, who's available, and at what price? And one would think, like the airlines, we would all be able to see either supply-demand pricing or we'd be able to see fair market prices. And so can't you imagine when all these prices are unleashed that, like the airlines, what happened when the airlines were deregulated in 1978 when Carter deregulated the airlines? I know because my mother was a travel agent and she had access to the terminal. And when you used to get, some of us are old, when you used to get those tickets, they would hand write them out on the red carbon copy, and only the travel agent who got a 15% commission on the top price you would pay at the time, those travel agents had access to prices, but we didn't. And they had access to where the routes went, but we didn't. So we depended. Just like healthcare, we were in the blind. And once pricing was deregulated and everyone posted their prices, and then we came onto an online economy, prices in real dollars today compared to the airlines of 78 are half the cost, half the price of what they were then. And hundreds of millions of people that wouldn't have ever flown then have access to flying and are flying, and airlines are safer. So we have better quality and also at a far lower price and readily accessible, and we know what those prices are because we have financial certainty. And that's the other benefit of price transparency, is financial certainty, because people want financial certainty in healthcare. This is a 94% issue that polls bipartisan. 94% of Americans want to know prices up front. They want financial certainty, and they do not want to be surprised with medical bills that they never can afford. Nor do employers want to be surprised. And I'll give you an example. What has happened with this revolution, now that prices are starting to be revealed, is employers are waking up. They have woken up. And I can tell you from an experience last week that employers are talking about the cost of healthcare in the boardroom. In one public company board meeting, it was brought up that the company, a high growth company in these inflationary times, every company is looking at its bottom line and its costs. In a one patient, $5 million excessive bill came through to that employer plan of a self-insured plan. Unexpected $5 million. Now, in a growth company, earnings before interest and depreciation and taxes, so your EBITDA, if you look at a growth company that market value might be 10 times that EBITDA, that $5 million could equate to a $50 million loss or deduction in their market cap. You basically look at the harm that that does to their bottom line as they're trying to cut costs. Now, that boardroom and that employer needs to really look and drill down at those charges. And I was talking to Marilyn Bartlett about it last night, saying, what's your recommendation? And Marilyn shared, well, you got to drill down and you got to look at all of those charges and you got to negotiate it because you don't know what's being charged where. And those can be actually handled one-off and be driven down substantially. But if we don't have access to our prices up front and we don't have access to the billing and the payment data, and that's withheld from us, well, then how can you do your job as a financial fiduciary for your workers and your employees' wages? And, you know, I do a shout out for SEIU 32BJ. I know Cora is going to be speaking with you. But, you know, SEIU 32BJ, before all of these price transparency laws and rules came into effect, did the hard work. With 200,000 employees, they did the hard work to drill down on what they were paying as really fiduciaries of all of their workers' paychecks and their income and their take-home pay. They drilled down to figure out what were they paying in their claims, in their bills, how did each of the New York and New Jersey and the East Coast hospitals compare, and they were able, by changing their plan design, in the first year to save over $30 million. And I'll let Cora tell you about that. But year after year, because of those millions and millions of dollars of savings, which I think the leader says now is almost over 100 million, when you look at what they were able to do to give the biggest raise and to give the biggest bonus in the history of the organization to 200,000 people and their families, that's huge. And what did they do? Carve out a hospital from their system and steer to better care at a better price. This is so transformative to have access to all prices that not only are we seeing it as a revolution, but think about where we need to go. Like today, with price transparency 3 years in, we really should be in the place where we could go online and search for that MRI in a Google search. But we should also see like Uber apps. Think of the vision of the future where, like Uber, and if someone needs an MRI in my family, we should be able to go onto like an Uber app that allows every standalone imaging center and every hospital to bid and tell us when they're available and to bid for that lower extremity non-contrast MRI. And if you think about it, they could even send the Uber to come and get you. And I mean, it's a great business model, right? You could send the Uber to take you to that MRI and take you home, and you could do it for thousands of dollars less. You know, I kind of like to joke because I'm starting to see a change when you can even change, you know, your spouse. It's a big deal. You know, I kind of joke and say, you know, it's hard to teach an old dog a new trick. But my husband did need 2 MRIs. And we live in Boston, and he was going to Mass General Brigham, and under our plan, the negotiated rate was $7,400 for the MRI. You know, Mass General merged with Brigham, so we're pretty concentrated and consolidated in Massachusetts, so we don't have many competitors. So we have probably among the highest prices. So even getting the cash price from Standalone Imaging Center was $1,300. And then my right hand who works with me side by side said, I'm going to do better. So she found $900 in Massachusetts. Well, we happened to be down in Florida, and I knew of Green Imaging, that you could go online and they use excess capacity, and I showed him that for $400 he could go to any of these different centers 20 minutes from where we were vacationing in Florida. And so he had a great MRI there, had it done, quality MRI, and then for the second one he thought, he's going to compete with me. And he was able to go to a hospital, standalone imaging center linked to a hospital, and get it for $250, his second one. So think about that. When you have 6,000 covered lives in your company, if everyone in your company got an MRI for $250 to $400, let's say in that range, versus paying over $7,400, which is your negotiated rate, just the MRIs alone would be thousands and thousands of dollars that could go back into employee paychecks and take-home pay. So this is the beginning of the revolution, and we have miles to go before we sleep, but don't give up because we are winning. We are winning on so many fronts. And price transparency doesn't stand alone in its benefits because everybody wants to know, well, what am I going to get for that price? What's the quality? And what's the outcomes that one could expect? So when we start to see prices, we will also start to see a functional and competitive market where the great reveal will be, show us your quality. You know, how many tonsillectomies and adenoidectomies has this surgeon done? And what has been the outcome? And how many have had complications like thrush or a hospital-based infection? Let's get the data. And then let's choose and let them compete on quality, outcome, access, and price. So the good news is even Colorado, that's sort of ahead of the curve on getting this price transparency unleashed, we saw for the first time 2 weeks ago a new entrant called Smith Medical Surgical Center. And just at a first glance, knowing someone who is a JetBlue pilot and whose son just had a tonsillectomy and adenoidectomy, saw that had he taken his son to this Smith Medical in Colorado, he would have gotten the care for half the price of what he paid. So all in around $4,000 versus approximately $10,000 in the local hospital. So his comment is, could have saved my whole plan and gone skiing in Colorado and first dropped my son off for his tonsillectomy at a hospital nearby and vacation with the family after that. This is revolutionary because employers that are making the difference across the country do send their employees to get the knee replacement all in at Texas Free Market Surgical or Oklahoma Surgical. For we know that knee replacement all in, including rehab, is around $19,000, $20,000 max. Coming in here today, I was speaking with one of the brokers who was really proud of the direct contracting that you all have here, which, you know, God bless you, you're doing a lot better than other employers, but around $28,000 for that knee replacement. Still relatively a better price than what we've seen billed at $120,000 for non-complicated knee replacements. So keep up the good work and know that when we all see prices, we should know where we should land for a fair market price and not agree to pay more as employers. And that power is going to be to all of us. You're going to hear from other speakers today, but it takes all the hard work from the C-suite. The CFO, to make sure that, like procurement, you're managing with HR by the numbers. And your legal counsel in your employer business to not agree on any contract that asks for anti-audit provisions or gag orders, right? I mean, who wants to hide the numbers? Who wants to control and have anti-audit provisions? We would not accept that in any other facet of our business. And I challenge anybody who uses Deloitte or Ernst & Young or any of the Price Waterhouse or any of the big accounting companies, why are you not auditing, as for public companies, the health benefits plan and the numbers? It's going to take all of us to take off the blindfold and refuse to sign a contract that has anti-audit provisions and make our auditors look at our hundreds of millions of spend if you're a big company like Aramark or Kraft Heinz or Ford Motor, because they've woken up. And what have they done? They've sued because they haven't been able to get access to their data to audit it. And so Kraft Heinz sued for $1 billion too, Aetna. Ford Motors sued on some anti-competitive behavior in Blue Cross Blue Shield. Aramark's just sued over $1 billion. These are big, big numbers. And this is a big opportunity for all of us to save tremendously. So I thank Sean with National Alliance, and we've got the Purchasers Group in Health. We have a coalition that has been so supportive of this movement, and it's going to take all of us to effect change. And I want to wrap up to finish to say, I also want to thank what's gone on in Washington. This is so bipartisan supported that even in this troubled Congress, the House passed a lower cost for more transparency bill with flying colors earlier in the year. And to tell you what's even more important is the Senate bill, led by your very own Senator Braun, who I believe we're going to be seeing later today, and Max Seltzer, who's sitting here with us in the audience, who's been the legislative director for the senator, and in partnership with Chairman of the Senate Health Committee, Bernie Sanders. I mean, Braun and Sanders. Think about it. Bipartisan support. And even though we knew that Bernie Sanders has always wanted Medicare for all, he wants to make sure in his vision for the future that the government doesn't overpay. And what we first need to do is unleash competition and market forces to be able to see what could be the lowest possible price, even if he's supporting universal health care. And in the meantime, whatever health plan we all have as a country, we know right now it's the employers. And the self-insured employers and all of us, unions, employers alike, are really the revolutionaries for this movement. And we are so grateful to all of you because over 60 million covered lives, thank you for the leadership of this forum and others, along with the firefighters nationally, the National Orders of the Police, school teachers unions, SEIU 32BJ, and we also have bricklayers and carpenters, all have weighed in to support this Senate bill. Why? Because the Senate bill allows for no loopholes. The Senate bill allows for actual prices, not estimates. And the Senate bill allows for all of you as employers to have readily available free access to all actual prices from hospitals and insurance companies with not information blocked or cluttered files, but real access, freely available, and access daily to your billing and payment information with the electronic feed file, just like we have in every other market, where when we pay from Venmo or our American Express card or anywhere else in any other market force, we have a price, we get a bill that matches that price, and we have a payment receipt all at our fingertips that we can be the auditors ourselves to make sure, yes, this is with financial certainty, the prices we agreed upon, these bills are indeed accurate, the payment went through, it came out of this bank account, and now I have accountability and integrity in the healthcare system. This change is so transformative, and it's going to take all of us to keep the shoe leather and keep the energy and keep going on the effort to deliver the American competitiveness back into our businesses, into our school district budgets, into our municipalities, so that our funds and monies go to the core of our businesses and the core of our budgets and what we do in each of our individual missions, and not be hemorrhaged out with double-digit overcharges in healthcare and coverage. So I thank you. Thank you for this time, and thank you for being the revolutionaries for our country.
A troubling new trend is coming to a business near you. Prices are hidden, and consumers are left guessing what they're on the hook for paying.
When they ask for a price, we give them an estimate. Then we build them whatever we want.
It's called the hospital pricing method, long implemented by hospitals and insurance companies to create unprecedented wealth.
Yeah, we don't do prices. We'll send you a bill.
More businesses are adopting the hospital pricing method, and if you've been to a hospital, you know what that means. Estimated pricing with huge surprise bills later.
Overcharges, price gouging, and ultimately turmoil and crisis at home.
Estimates.
How much is the ice cream?
Prices? No, we don't have those anymore. We have estimates.
Estimates?
A b-
I think you guys can go home now. That was just an amazing presentation by Cynthia Fisher, and she just did a fantastic job framing everything that you're going to hear today.